Hey everyone, welcome to my channel. That picture looks familiar for most of you. Tooth pain, sensitive tooth, just name it all, just brings her bad memories. Today I want to make this video to help out everyone who is going through the problem of sensitive tooth and tooth pain, where you're looking for a quick remedy of to eliminate the pain without the need of any medication or painkillers or whatsoever. Now, this video is not intended to stop you from going to a dentist. Now, keep in mind that you can have tooth pain or sensitive tooth due to many reasons. That could be things from cavities, tooth decay, any abscess tooth, gum infection, gingivitis. You just name it all. Like, it can be many different reasons. But if you're going through pain, you're looking for some sort of a symptom relief to eliminate the pain. I want you guys to try today's technique. This is something which has personally worked out for me. I always like to do videos when there's evidence based, where there's proof that we're doing something. There's a little bit of a scientific evidence, a little bit of anatomy played in place, and these are all reasons I want to use today to make this video. Okay. Now, before I show you this simple technique which you can do at home, I want to show a little bit of anatomy of what's designed on the tooth. Things like the nerve supply. What nerves supply the tooth? Where are the branches? So the knowledge of that is going to be very important for you to apply the two techniques which I'm going to show you today. Okay, so let's dive down and see a little bit of anatomy of the tooth area before we get to the technique. Okay, let's look at a little bit of an anatomy of the upper jaw, the tooth, and some of the nerves which supply the teeth for sensory supply situation. Now, you notice an important nerve which is sitting right here. Just let me bring my pencil function. All right, take a look here. I'm going to circle this. This nerve is called the maxillary nerve. Now, it's sitting a little bit underneath and inside of this big arch. Now, this arch is called the zygomatic arch, and this is the zygomatic bone right there. Now this nerve, you can see here, divides into three branches, one, two, and three. The one branch over here, it's called the posterior superior alveolar nerve. The branch over here, this is the middle superior alveolar nerve, and the branch over here, it's the anterior superior alveolar nerve. Anyway, let's not get into the details of the location, but rather if you watch these nerves and look at the place where the nerves go in and just go and supply sensation for this tooth. Now, the posterior superior alveolar, you can see here, they just branch down and to supply these tooths. Now, if you know the names of some of these tooths on the upper jaw, you can see here. So these three are the molars. This is the first molar, the second molar, and the third molar. And these two are the premolars. Now, I've noticed in my upper jaw, I've noticed that I do not have the third molar. I only have two molars. I'm just going to come back here. This is my problem tooth right here. This tooth is emitting a lot of pain and sensitiveness right now, and I know right away that it's supplied by the posterior superior alveolar nerve, which is actually a branch of the maxillary nerve right here. Now my goal is to target the maxillary nerve, just like how if you go to a dentist office, just going to take all this out. Let's say if they want to do any procedures in your tooth, like tooth extraction or cavity filling or anything, they'll do is they'll do an injection right in this area, and what that drug or particular do is it'll block off this nerve from taking any information to the brain. That's the whole idea. Now, what I'm trying to explain is it's the same principle. My goal is to block this maxillary nerve by using icing technique, also called cryotherapy. Now, depending on which tooth is causing a problem, uh, attacking this major nerve and causing a nerve block using the icing absolutely works miracles for me. Now, let's get into the technique to see how it's done. All right, so I hope you learned a little bit of anatomy with that animation which I just showed. Now, let's get into the technique, how to do this, okay? Now, when you go to a dentist, there's something they do, it's called the nerve block. What they try to do is they try to block the nerve by using medication like a needle or a drug. So what it does is it does not send the information from the nerve to the brain. So it just kind of cuts it off. I'm going to use the same principle, how to block the nerve without the need for drugs or medication to stop it from sending the signal above, right? Now, based on the anatomy you just saw, my problem is the second molar, which is right on the top right there. Now, based on the anatomy, you notice that is this big bone right there. This is the zygomatic bone. And then you can see that's the arch, which is right here. Just underneath right here is where the maxillary nerve is, right there. I can feel like a little pouchy area that's sitting right underneath there. That's a nerve I'm going to target. Now, you're not going to believe me what I'm going to use. Take a look at that. It's nothing but an ice pack. You're not going to believe me. It's an ice pack. Now, I know everyone's going to go like, this sounds crazy, because whenever you have sensitive tooth or toothache, anything cold hits the teeth, it's going to kill you. You're going to go crazy. I understand that, but keep in mind that we're not putting this ice on the tooth, but rather we're attacking on the nerve, okay? Now, what I'm going to do is, now I'm not going to put this ice pack directly on my skin, but rather, I would suggest you just use a simple paper towel, just maybe one layer of that should do, so that you're not putting the ice pack directly. It's not, it's recommended. Okay, there we go. So I just folded this ice pack into a nice little ball right there. Now here's my goal. I'm going to apply this ice pack right on that maxillary nerve area, and I'm going to let it sit for about 3 to 4 minutes. Now, this is what's going to happen, okay? I'm going to caution you. The moment the ice pack hits, it goes through 4 phases. The first phase is simple. The moment you put it, you're going to feel cold. Simple, okay? Now, that cold is going to slightly turn into burning. I like a burning sensation. I don't want you to panic, which is very normal. You're going to feel a little bit of burning on the skin or maybe even underneath. The third sensation you're going to feel is aching pain. Now, this is where most people panic. Oh my God, I'm putting the ice. I can feel the pain on my cheek area and my tooth is increasing. Now, I want you to hold on to that ice pack. Don't remove it. Just bear that pain. And the fourth sensation is what we call as numbness. So the 4 stages of coldness, burning, aching, which is pain, and the 4th thing is numbness. I want you to take the 4th level. If you can just withstand that, that's going to completely block that nerve. So my goal is to desensitize that nerve from sending the signal to the brain. Now, it's been like a week. I've been having a cold and a cough. I'm overcoming that. I've noticed that this sensitive tooth is probably due to my excess coughing and maybe because of the cold itself. So yesterday I tried this like 3 times, and today I can chew on that tooth. I don't have a pain. I don't have sensitiveness. That pain is gone. So all I'm going to do is, once again, I feel for the bone, feel for the arch, little pouch at the bottom, take that ice pack, put it right there, and I'm just keep it right there. And that's all I do. Just keep it right there. Now, that tissue paper I'm holding with the hand, so the hands don't feel cold, and leave it right there. So 4 sensations you can go through, and you'll notice if you got the right target, when you clench your tooth, you're going to have pain, of course, to start with. But then as the ice is taking effect, you feel that when you're clenching the tooth, you don't feel the pain. That at one point, when it's all numb, you know that you completely blocked the nerve from sending the signal to the brain. Okay? So that, I'm telling you, it sounds so simple. I want you guys to try this and see if this works for you. This has worked like 5 years back. I had the same problem. I did this once. It's been good. I didn't have any problem. I go to my dentist. Everything looks good. I don't have any tooth decay. But this is just to get rid of the pain. This just worked miracles. But once again, do not stop yourself from going to a dentist. You may really need to check to see this pain could be due to other reasons as well. But this at least helps you to reduce the pain and at least symptom free. You get your sleep back. You can do your activities. You can concentrate on work and things like that too. Now, here's an add-on. You may want to try along with that. Now, this is something I've tried. This is interesting. Take a look here. Now, the company is Sensodyne. So Sensodyne is an amazing brand for toothpaste. Now, I'm not branding, I'm not marketing for that company, but all I see is, you see the word here, Sensodyne Rapid. Now, this is what I do. I take a little bit of Rapid, that paste, And you can dab it on a finger or you can dab it on your toothbrush, and you have to take that and rub it on that tooth where you have pain and sensitiveness. So make sure you also attack the gums inside when you do that, and then you can just gargle and let it out. It's fine too. Now, along with the icing and this Sensodyne Rapid, I'm telling you, you can totally desensitize the tooth and you won't have pain at all. Okay, I want you guys to try this icing, Sensodyne Rapid application on the inside of the tooth. Hopefully this helps to get rid of your tooth pain. Please put your comments if this worked. I would appreciate subscribing to my channel. If you want any of the videos, I'll be more than happy to do that. All right. Good luck, everyone.